Whenever you're all phones on silent. The head of the Accident and Emergency Department at the Dominica China Friendship Hospital, Dr. Carl Monroe, and also with us, the District Medical Officer, Dr. Dylan Dyer. We want to say a special thank you to all those of you who are tuned in this evening. Our thanks to our media partners for making this simulcast possible this evening. We have a pretty long program, longer than usual for you this evening, including 5 presentations, so we'll get right to it. And as always, we'll begin with the national epidemiologist, Dr. Shaluddin Ahmed.
Thank you, Ms. Harry. Honorable Minister of Health, Dr. Arvin McIntyre, Permanent Secretary, Mrs. Leticia Lestrade-Wake, Chief Environmental Health Officer, Acting Ms. Tassie Thomas, Head of Accident and Emergency Department, Dominica China Friendship Hospital, Dr. Carl Monroe, District Medical Officer, Dr. Dylan Dyer, and Attorney General, Mr. Levi Peter. Good evening to everyone. As of today, total confirmed cases of COVID-19 are 15. The last confirmed case is a contact of index case number 3 from Concord. Let me elaborate index case number 3. Case number 1 and case number 2 and case number 12 are considered to be index case 1, 2, and 3 because the fact that they were contracted the disease not from within Dominica, not from any Dominican, and in Dominica. They had travel history. 2 of them had travel history before they developed the symptoms, and 1 of them had contact with a known with a possible traveler with a possible case of COVID case who actually visited Dominica, and as a result of that, these are the 3 confirmed cases which considered as index cases, and these 3 contacts, index cases, had multiple contacts. So a total of 59 contacts have been identified from this 1 index case alone, index case number 3, and all of these contacts have been tested. Of these, 20 were first generation contacts, and of them 2 were positive. And from these 2 positive contacts, again, there were 31 contacts were identified and tested. Out of these 31 contacts, 1 became positive, and which is the case number 15 today. And subsequently, 8 more contacts were identified from this last confirmed case, or case number 15. So far, the chain of transmission occurred only from the 2 cases, the index case number 1, that is from La Roche area, and index case number 3, who is from Concord area. Hence, we are in stage or phase 3 of transmission, which is called cluster of cases. With regards to demographic distribution of these cases, 10 are male, 5 are female. Their age ranges from 18 years to 85 years. The median age is 54 years, and most of them are from 2 health districts, in La Plaine and Marigot health districts. All 15 cases are hospitalized, and all are clinically stable at this stage. The first index case had been discharged home yesterday following 2 negative test results within 24 hours, as per WHO protocols. And the patient is actually placed on a 14-day home quarantine. There have been no deaths due to COVID-19. As of today, a total of 306 persons have been tested using in-country molecular technology or PCR testing. Of these 306 cases, 291 are negative. Let me just translate this in another way. The rate of the person that's been tested in Dominica is 43% per 10,000 populations. In comparison to other OECS countries, it is much higher. It's much higher. For example, in St. Kitts and Nevis, total number of persons tested were 34 per 10,000 populations. In Antigua and Barbuda and Grenada, they are tested only 4 persons per 10,000 populations. So in OEC, among the OECS countries and in the greater Caribbean islands, actually, we are way ahead of many countries, except the Cayman Islands. They are actually tested much more people than us. They tested about 72 persons per 10,000 populations. In terms of quarantine facility, currently a total of 16 persons are at the government quarantine facility. A total of 169 persons were sent home following completion of 14-day quarantine period with clear instruction to stay home and keep social distancing. Lastly, I want to remind everyone that this virus will continue to live among us if we let it pass on to others. So, in order to kill this virus, we must exercise social distancing and stay home. I also want to remind you that no amount of closure of border or curfew or sacrifice of healthcare workers can prevent the spread of this virus, except that each of us play our part and stay home, continue to maintain physical distancing, wear a mask properly if you are outside of your house, practice respiratory etiquette and hand hygiene. These practices are proven to be fruitful. So far in New Zealand, actually, it has been less than 2 weeks that since New Zealand imposed coronavirus lockdown, and number of new cases has fallen for 2 consecutive days. And they are actually gearing towards complete elimination rather than containment, as they plan to complete 4 weeks lockdown, total full 14-day incubation cycles. So I don't need to remind you again what is happening in the rest of the world, in the Caribbean and rest of the world. Number of new cases and deaths are increasing on daily basis. Number of deaths in the United States, just one day alone, is close to 2,000, and it is about 57% jump from the previous day. And similar situation you can see in Spain, Italy, and UK. Number of hospitals in UK actually reported that they don't have any more body bags. So I urge you all, think before you do, and listen to the health officials, and stay home and maintain your social distancing. With this, I thank you.
And our thanks to Dr. Ahmed for his presentation. As always, concise, but also very informative. And as we would have heard from Dr. Ahmed, in Dominica, there are 15 cases confirmed, still 3 index cases in Dominica. Our next presenter is the Chief Environmental Health Officer Acting, Tassie Thomas. And even with the borders closed, you would have heard that she and her team had been doing so much, but they continue to work and there are lots of concerns that remain for her team, and she's here to present on that this evening.
Good evening, everyone. Protocol has been set, so I will get right to it. Our primary focus in this pandemic is one of border protection, meaning the monitoring of our ports of entries, our airports, and our seaports, all in an effort to prevent and to minimize the entry of illnesses or diseases into our country. The port health officer is the first person that the passenger comes in contact with as they get off an aircraft or a boat or a ship. The port health officer takes temperatures of passengers. They interview passengers to collect key information that may be needed in the event that something comes up later, and also, they educate passengers on the 14 days mandatory quarantine at the facilities in Portsmouth. One may say that the ports are closed, but there are what we call unforeseen circumstances, where, for example, a flight may come in with 1 or 2 passengers, and we have to respond. Okay, monitoring continues where the cargo boats are concerned. We have cargo boats coming in, bringing important supplies such as food and medicine and other medical equipment to our country. We cannot say no for this. We have measures in place and we respond accordingly. Also, we have the yachts in Portsmouth. I know it's something at the top of everybody's mind and so on. But I must say we have a smooth monitoring thing going on in Portsmouth where the yachts are concerned. You know, earlier in March, when there was the regatta that never took place, there were a large number of yachts at the marina in Portsmouth. Some of them left, but as many as 64 remained. And there are 3 yacht owners in Portsmouth that have been in the marina almost a year now. And I must commend them. They are very instrumental in assisting the port health officer with the monitoring of the yachts, where the yachts are counted every day. If a new one should join, they are right on top of it. Education has been carried out with these yacht people, and by now you should know the yachts that are there, they have already had the 14-day quarantine period expired. Nobody has reported any sign or symptoms of any diseases, and also there is one individual who represents all the yachts in Portsmouth. Contacts are being made through this person to assist with getting supplies for these yacht people on land and so on. But as of now, as I said, they have gone through the 14 days quarantine period, and some of them are able to come ashore to do banking, for example. Every morning, the yachts are counted to ensure that no new ones has joined the fleet. Sorry. Okay, so to this end, on the 30th of March to the 31st of March, a large number of the yachts left. as many as 27. So right now there are 40 of them in the marina, and they are being monitored by the Port Health Officer and other key persons in Portsmouth. Okay, the Environmental Health Department also carry out daily monitoring of the quarantine facilities in Portsmouth. That is, they ensure that sanitation is maintained at these facilities, especially sanitation. Another thing that we do is the burial of the dead. We make arrangements. We have already educated and pass on key guidelines, short, simple key guidelines to the funeral homes as it relates to the management of the dead and burial. So we are on target. Let me take a minute here to commend my dedicated environmental health staff, especially those operating at the points of entry, for the work that they are doing at these ports of entry. One may say, but it's their work. It's more than their work. When you think of Sunday night, 9 o'clock, you're already in bed, and the call comes that there's a boat in the harbor, just arrived, there are passengers on board, and we require the services of the Port Health Officer. The officer jumps into action, no questions asked. I say it is more than just their duties. I say it is dedication and commitment to the job. And as managers, we should always take time to appreciate our staff. And there is another category of staff that we should not forget. I wish to, from my heart, to commend the solid waste management team, Mr. Florian Mitchell and his team, for the very good work that they are doing. And they actually go the extra mile to do what they do when it comes to the management of waste, especially at our quarantine facilities in Portsmouth. Let me leave you with something. Fear. Let us not let fear take over our lives. Fear causes stress, and stress shuts down our immune system. And in this pandemic right now, we need our immune system in tip-top shape. Now that we are at home, we are asked to remain at home. Don't go out there. This will help in lessening the burden on our health system. You take care of yourself, you protect yourself. Whilst you're at home, find something good to do other than listening to every voice note and watching every video that you get from social media as it relates to the coronavirus. All it does is creates fear in you. You are confused. So many of them, you do not know which one to believe. Don't let these things take over your life. Instead, you're at home, go to YouTube, download comedy, watch a good movie, laugh as hard as you can until you cry, but think happy thoughts. Let happy thoughts take over your system at this time whilst you are home. Don't think about things to create fear in your body. And if you do that, trust me, it will help a lot, because I think no disease will come near you if you're a happy person. So with this, I say thank you.
And our thanks to the Chief Environmental Health Officer, Tassie Thomas, for that report on the work being carried out by her team. Our next presenter this evening is the head of the Accident and Emergency Department at the Dominica China Friendship Hospital, Dr. Carl Monroe. Of course, many of you would have already noticed that there are new protocols established for the Accident and Emergency Department, so he'll once again highlight some of those.
Thank you, Ms. Hari. Honorable Minister, Dr. Irvin McIntyre, Attorney General, Mr. Levi Peter, PS of Health, Letitia Lestrade-Wyke, National Epidemiologist, Dr. Shaluddin Ahmed, District Medical Officer, Dr. Dylan Dial, Chief Environmental Health Officer, Acting, Tassie Thomas. Greetings, my fellow Dominicans. During the onset of the COVID-19 virus pandemic, the question may be asked as to what is the role of the Accident and Emergency Casualty Department at this time, and what assistance does this department render to the public? The A&E department's role is to provide screening to the public for the COVID-19 virus at 2 levels. This screening occurs when one accesses the Dominica China Friendship Hospital. Level 1. At level 1, a tent is set up at the general entrance, now located in the hospital car park. There, one is met by medical personnel and support staff, where one's temperature is taken, a questionnaire implemented where basic questions are asked. At this level 1 is also questioned as to the purpose of business at the hospital. This level 1 screening is done to regulate, and should I say, limit the unnecessary flow of persons in and out of the hospital, and in so doing, limiting the probability of spread of the COVID-19 virus to this vital healthcare facility. At this stage, I wish to remind the public to respect visiting protocol. After the screening at the general entrance, members of the public are then directed either to the traditional A&E department or the flu respiratory symptoms screening department. Level 2. At level 2, there's a traditional A&E department where we continue to provide services to the general public. That is the management of true emergency cases. At the A&E, we are conscious of the need to implement best practices during this pandemic, and therefore at the department. Social distancing, hand sanitization, provision of face masks to patients are enforced. This is of utmost importance to ensure that the A&E remains safe and takes necessary precautions during this pandemic. At A&E, we do not deal with suspect COVID cases, and this is to ensure that this department remains available and virus-free to the public. I stress that A&E remains the department for emergency cases. Please avoid coming into the department for checkups and prescription refills, etc. Please contact your nearest health center, as health centers have put in things in place to deal with non-emergent situations. Members of the public are directed to the flu respiratory screening department area, which is located at the back of Emory Ward, or as we all know it as the Alford Ward, or opposite to the pharmacy. There, one will be met by a nurse and a doctor. The questionnaire is reviewed and augmented to discuss possible contact, travel history, especially within the past 14 days of symptoms. Vital signs are taken, the necessary care given, that is, medication given, tests administered, and necessary decisions taken as to further investigation of the COVID-19. Allow me to emphasize and encourage the use of the hotline 448-2151, 448-2153, 448-2156, 611-4325, 1-800-219. Persons presenting with persistent fever, continuous cough, with or without sputum, weakness, sore throat, loss of appetite, difficulty breathing, should contact the COVID-19 hotline. Please stay home and do not just show up to the hospital if there is a suspicion of COVID-19. Please call the hotline first, as there are systems in place to deal with such situations and where one will be advised on the steps to be taken and possibility of sample taking. It is essential that the A&E department is kept separate from the COVID-19 screening at this stage for the safety and well-being of the healthcare staff who take care of you and your loved ones. It is the responsibility of the patient displaying flu-like symptoms to consider persons with underlying comorbid conditions. Consider your grandparents. Consider the asthmatic, the hypertensive, the diabetic, etc., would be greater affected by this COVID-19 virus, and take the necessary precautionary measures. We all have a part to play in this fight against the spread of this COVID-19 virus. I would like to encourage the general public to continue to cooperate and comply with the guidelines of the Ministry of Health. Continue social distancing, hand washing, sanitizing, cough, sneeze etiquette, wearing of masks when possible, staying at home, especially when sick. Please use the use of the hotline. In closing, let me thank the many persons who are in one way or the other have been involved in the fight against the COVID-19 virus. The Ministry of Health and the Government of Dominica, and the friendly nations who have donated equipment and human resources. To the hospital administration, domestic workers, ward aides, orderlies, X-ray technicians, lab technicians, nurses, doctors who are all working tirelessly, I thank you.
And thank you very much to the head of the Accident and Emergency Department at the Dominica China Friendship Hospital, Dr. Carl Monroe. Again, if you need to go to the Accident and Emergency Department, it is not business as usual where you just walk through the front door. There are protocols set in place, so we ask you very kindly to cooperate with all those who work in the tents, that you follow the instructions very carefully, and then you will be directed to the appropriate section. Our next presenter is Dr. Dylan Dyer, and he is a district medical officer. He, of course, works very closely with someone whom we've had present several times, Dr. Laura Esprit. And Dr. Dyer will do a presentation on what the districts are doing to help with the preventative measures as well as the contact tracing, which they are responsible for.
Thank you, Ms. Howard. Protocol has been established. Good evening, everyone. I am here as a district medical officer of the Roseville Health District and part of a contact tracing and sampling committee headed by the Director of Public Health Care Services, my direct supervisor, Dr. Esprit. I form part of a mobile team responsible for contact tracing of persons who have tested positive for COVID-19 on a community-based level and sampling of these contacts of persons who tested positive for COVID-19. We are called a mobile team. Why? Well, we are based at the Roseville Health Center, the Roseville Health District, but what we do is we are deployed on a daily basis to different districts to aid those DMOs. At present, we have about 3 mobile teams, right? We call the mobile unit, and what we do is okay, when given directives from the committee established just for that purpose of finding contacts, people who tested positive for the COVID-19, we are deployed, given that, okay, we have a certain number of contacts in a certain district, we are deployed to that district, and the aim is to test those contacts, right, using our PCR testing or sometimes rapid testing, right, and we collect those samples, and our main job is to get those samples back to the lab the same day. Why the same day? This is a time-sensitive matter. We can't have people out there possibly being infected with this virus and are just gallivanting about. Now, some would say, well, that is not the case. People are asked to remain at home, so they shouldn't be gallivanting about. Well, that is simply not what we are being faced with every day. So as doctors, given that we are in this serious time, there's no choice but to be ready to move at a moment's notice. I am here speaking to you, and my phone could be ringing. I wouldn't know. I was told to put it on silent, but I could be deployed at any time to any district to help with that, what I just mentioned. It's not an 8 to 4 job. It is not a Monday to Friday job. It's around the clock. And that just goes to show the level of importance, finding people who may be exposed to this virus is. So, I'm here today really to give a play-by-play as to how it goes, how it works, what my normal day is like. Like I said, I'm a DMO, so I present myself to the clinic. I work with patients, I deal with patients there. But I also know that my top priority right now, as part of the mobile unit, is to listen out for a call from Director Esprit or one of the other persons on the committee, telling me, okay, we have a certain number of persons who may have been exposed, who may have come in contact with someone who tested positive for the virus, and we need you to go to District X, for instance. Okay, Dr. Esprit, District X. What time? No. There's no waiting for later or tomorrow, no. So we got up our equipment, our PPEs, our testing kits, coolers, etc., a few snacks for the team, right? Which comprises of the team that is a DMO, like myself, family nurse practitioner, a nurse instead, or somebody on the team responsible for the welfare of the patients, the team. Well, by welfare, I mean, for instance, we have a person on the team whose sole purpose is to ensure that I do what I have to do properly at all times. I stand before you wearing a mask. I'm a human being. It is sometimes uncomfortable, and I may feel like the need to touch it, move it. I'm always next to someone who would be like, doctor, your hand is too close to the mask. Doctor, you should change your mask. Doctor, you should change your gown. Doctor, your glove needs to change. And I do it. We're human beings. We sometimes slip up. But this is serious business right now. So we have to ensure that we're always on our A game. Someone is on the team specifically for that purpose. So now we've gotten our call, we've gotten our numbers. Persons we're going to sample, swab, for instance. Okay, we've gotten our equipment together. We have 2 buses normally at our disposal. If we need more, we ask for it. We have a driver always ready and waiting. Okay, cool. We head to the district. At the district, we normally meet the DMO of the district, who would most likely be engaged already in testing persons. Because like I said, we provide assistance to those DMOs. They're in the fight. They are the focal points. So we meet up with these people. We discuss our plan or strategy. Sometimes we go house to house to the different contacts. Other times, if they live close enough to the health center, we ask them to come to the health center. And we test them there. It is a very fun experience. I know that might be the word you would expect for me to say, someone running towards COVID, but it is fun. It is exciting, but it is very challenging at the same time, because we have to remember that you may contract the virus, and well, you get infected, and nothing much might happen to you, but the elderly lady who lives next to you, the diabetic woman, the diabetic child, the asthmatic person, you understand, the person who is immunocompromised, this disease will, for lack of a better term, mash them up. And these are things, when we stop and we talk to people in the district, we appeal to their humanity. Because oftentimes we meet with people and they say, well, doc, it's just a flu. I drink water, flu will go. Yeah, think about others. You may be healthy and strong, okay. Your neighbor mightn't be, your mother might not. What about your elder daughter at home, your son, you know? So part of our job is also to educate the public. Part of our job is to provide psychosocial support, because, you know, since the rise of COVID, you have a lot of panic going around. So we can't, as doctors, can't just go and test and leave. No, can't do that. Speak to people, talk to them, help them understand. Education is one of the best medications you can provide anybody. And tell them, you know, stay inside. Social distancing is key. And we hope for the best. However, some of the challenges we face is that people, for some reason, refuse to adhere to the protocols established. And even after we tell them, please remain indoors, they tend to go out on the roadside, go meet the friends for a drink. And this is where things get real complicated for us, because at times we go to your homes to test you and you're not even there. Where are you? You're by your neighbor. That means you're coming in contact with about 6 other persons or so. And sometimes we don't have that much test kits available to test all these people. So we have to hope and pray that your result come back negative, else we'll have to come back there again, test everybody, plus whoever else they came in contact with. So it is a trying situation, but it is one we can overcome. I believe we can overcome it if we just adhere to the rules. Okay? So that's basically what we do. And let me just take this little moment to thank my team. We have been at it for quite some time now. You know, I think we are running purely on adrenaline right now. You know, but thanks to all the doctors, the nurses, the cleaners, the bus drivers, the fire officers, everybody, even the doctors holding it down at the hospital. We appreciate all what you do. We appreciate you, and it's a war, but we will win. Thank you very much.
Let me say a special thank you to Dr. Dylan Dyer, the District Medical Officer, for his presentation. I'm sure many of us heard a little bit of emotion in Dr. Dyer's voice simply because, like he said, he and his team, they've been working tirelessly the past few months as far as the contact tracing is concerned. So we want to applaud them on a job well done. It's a thankless job, but we thank you anyways for that. Thank you for your dedication over the past few months and the dedication it will require henceforth to keep everyone safe and to do what it takes to protect all Dominicans. Thank you again, Dr. Dyer. And as we prepare for perhaps our longest lockdown so far, it begins tomorrow evening, we have with us the Attorney General, Levi Peter, and he will go into some more detail about what that lockdown entails, what curfew entails, and we thank him for sparing some time this evening. So again, the Attorney General, our next presenter.
Thank you very much. Good evening, everybody. Those within this room and those wider afield. Protocol has been established, so in the interest of time, I will move straight ahead. I think everybody who's hearing my voice now will be aware that curfew is in effect in Dominica and has been so from the 1st of April of this year. And that curfew, according to the order initially made, is in effect until the 20th of April. And by way of resolution at Parliament on Monday, the resolution was passed by Parliament to extend that order for a further 21 days, so taking us into May. But for the purposes of the exercise, I think it's what I would suggest is that people focus on the fact that, one, there is in place a state of emergency in Dominica. Two, that there is in place a curfew, and in fact, that curfew is really a 24-hour curfew. And I think that ought to be the mindset that people approach the curfew situation with, and then they may find it easier to understand the meaning, because I have heard a number of questions being raised, some to me directly and some indirectly. But I think those questions arise largely because people fail to realize that the curfew order is really saying that everyone should stay indoors. In other words, they shouldn't be in a public place at all. That's the starting point. However, because of realities, the order makes certain exceptions. And it is those exceptions that perhaps may be of interest to some. But essentially what those exceptions amount to are to be out for the purpose of providing an essential service, or as a worker, or a person, as a worker, an essential worker, or a person who is accessing an essential service. So one should only be outside for that purpose. Insofar as the curfew is concerned, of immediate note, I would suggest, is that people understand that from tomorrow, that's what we locally call Easter weekend, from tomorrow, Thursday, 6 p.m., that's tomorrow, Thursday the 9th of April, from 6 p.m. until Tuesday, 6 a.m., that's Tuesday the 14th of April, no person should be or shall be in a public place unless they are a person who is an essential worker. Essential workers are, for the purposes of this order, 13 different categories, 1 Commonwealth of Dominica Police Force, 2 Dominica State Prison, 3 members of the judiciary, 4 officers of the Department of Social Services, 5 officers of the Department of Environmental Health Services, 6 customs officers, 7 Accountant General Division, 8 in the Revenue Division, 9 Waste Disposal and Sanitation, 10 any hospital or healthcare, medical, residential care establishment or facility staff, Dominica Air and Sea Ports Authority, official staff, essential officers of any water, electricity, or other sector encompassing provision of electronic communications, including print and electronic media, and 13, any public officer or category of public officers directed by the Secretary to the Cabinet. Now, of course, that doesn't mean that anybody who is an employee in one of those areas who is not engaged at the time in an employment activity as part of their work can be merrily gallivanting on the streets. Any such person in the categories I just mentioned is permitted to be out in the public place if they are at that time engaged in work or indeed traveling to or from work. Other than that, everybody should be inside. What we are referring to as a complete lockdown from Thursday, tomorrow, 6 p.m., until Tuesday morning at 6 a.m. Now, whilst on that, perhaps I should also indicate that the same principle applies to the weekends. That's from Fridays at 6 p.m. until Monday at 6 a.m. That's during the course of the curfew. So until the curfew is lifted, it should be noted, as for simplicity, that on weekends, there's effectively what we call locally a total lockdown. On weekdays, Monday to Friday, there is a slightly heightened extent of liberty, shall I call it that, which is to say that between the hours of 6 a.m. and 6 p.m. on Mondays to Fridays, people are allowed, or your person is allowed to be out if they are a person who is either providing an essential service or they are an essential worker. And I've already indicated what the categories of essential workers. And that, other than that, everybody should be at home. So I think for simplicity, people think, as I said at the outset, everybody should be at home, indoors. And in this instance, that includes your immediate yard, because it says a public place. But if you're not in the course, and so it's also simple to think, if you're not in the course of providing an essential service or accessing an essential service, then you should be at home or indoors, not in a public place. The only other category of person who is permitted to be out in a public place who doesn't fall within one of those categories I've mentioned is a person who has the written authorization from the Commissioner of Police to be in a public place. So it's a person who doesn't fall within the categories that I've mentioned, essential worker or somebody providing an essential service, but who has received the written authorization. It should be fairly obvious that the Commissioner of Police will not likely give that sort of permission. But there are, of course, circumstances and persons who may be able to satisfy the Commissioner of Police that it is reasonable and proper for them to be given that written authorization. I think most people are aware by now that the essential services are permitted to be open between 6 a.m. and 2 p.m. daily. That's Monday to Friday. There are In the case of pharmacies, these are permitted to open for an extra 2 hours, that is until 4 p.m. And that also applies to the construction industry, which is permitted to operate until 4 p.m., as is the commercial port, as our commercial ports and related businesses. That would be things like brokerages and so on. And in respect to the buses and hire and taxi cars, they are permitted to ply their trade between 6 a.m. and 5 p.m. So that really covers, I think, the timings. There's a lot more which could be said, but I'm hoping to try to keep it simple. And of course, we will continuously be speaking about these things. So as questions come up, we will seek to clarify any questions that people may have. I should perhaps also, so just to make it clear, essential services are permitted generally to open from 6 a.m. in the morning until 2 p.m. in the afternoon, with pharmacies, commercial ports. That's not the actual port activity, but the related activities, as I indicated, brokerages and so on, until 4 p.m. And also in respect to construction, operations are permitted to operate until 4 p.m. and buses and taxis and so forth are permitted to operate until 5 p.m. Questions have been asked of me, and I think of others, about weddings and religious gatherings and so on. Religious gatherings and weddings, well, churches are essentially to remain closed to the general public, other than for weddings and funerals, and those two events are permitted with limited numbers of guests. And I'm not going to go into the numbering at this point in time. If indeed what's important, I think, is for members of the public to recognize that. So if indeed one is to be engaged in that activity, then I would suggest that inquiries are made to ascertain, and I would believe that all churches would know what the numbers are, and we will be able to advise in a manner that's less complicating than inserting that into the current discussion for the purposes of tonight. I think people also are aware, just so that I try to touch something else, that liquor licenses are suspended from the 1st of April until Tuesday, the 14th of April, and that bars are closed. And in the case of bars being closed, that's for the entirety of the period of the order. So those who enjoy an alcoholic beverage will hopefully have some at their home, which they can enjoy if that's what they like to do. But the bars and so forth that normally sell liquor by way of license are prohibited from doing so during at least insofar as the license is concerned, until Tuesday, the 14th, licenses are suspended. So in summary, if I can summarize, there is a curfew in force in Dominica. That curfew is from 6 p.m. on the 1st of April of this year until 6 a.m. on the 20th of April this year. So the curfew is for the entire period. But there are certain exceptions to the prohibition on being in public, so as to enable people to engage in essential services, either as a provider of an essential service or by way of receiving, as an essential worker, traveling to or from that activity. And I've identified a number of specific essential services, and the times that they are permitted to operate from. In short, businesses that are essential services are permitted to operate between the hours of 6 a.m. to 2 p.m., and in the case of a few others that I've already indicated, until 4 p.m., and in case of buses, taxis, and hire vehicles, until 5 p.m. during the relevant days. That's essentially. I think that I have covered, in that short space of time allotted to me, the essentials, but if I haven't, I'm sure when I speak again, I will address anything that anybody brings to my attention. Thank you very much.
Our thanks to the Attorney General, Levi Peter, for this presentation this evening. Again, just a reminder that beginning tomorrow, Thursday, from 6 p.m. until Tuesday, 6 a.m., the country will be on a complete lockdown. After Tuesday, from 6 a.m. to 6 p.m., you'll be free to move about essential services and to get essential supplies. Then at 6 p.m. on Tuesday, curfew will take effect once again. Again, thank you to Levi Peter for that. I'd like to thank all those who have joined us this evening. We understand that every time a press briefing is convened, there's a certain level of anxiety that engulfs the entire general public, because most people tune in simply to hear, is there a new case? A wealth of information has been presented this evening. Many of our media partners will replay the press briefing. Of course, you can visit the pages of the Office of the Prime Minister on YouTube or on Facebook, so you can look at this press briefing over. If you've missed any of the information, you can absorb some of the information and get a clearer understanding of what was presented. So we urge you to do that, because our intent is never to come here to cause panic. Our intent is always to bring you credible information. So we ask that when you join us for these press briefings, that you do so not just to hear if there's a new case, but that you listen to the measures, the protocols, and the preventative practices that we echo every day to the general public. And that is the only way that all of us can do our part to help contain the spread of COVID-19. Thank you again to our presenters, and thank you everyone for joining us.